marks 2 years since the CDC confirmed the first case of COVID-19 in the U.S. And as we all know, our lives, they have drastically changed since then.
They're still changing. Yeah, with the introduction of new variants, guidance that often changes too. So many of you have questions. So here to break some of those down for us is Dr. Jamehdor, ER Medical Director over at Dignity St. Mary Hospital. Thanks for being here. Good morning.
Good morning. Thank you for having me.
Yeah, no, there's a lot of people right now still going to the ER with COVID. LA County even says about half of the hospital patients who are there for other reasons are now testing positive for COVID. And hospitals say they're also short-staffed for their own COVID sick calls. So right now, what should people do when they feel they need an ER for whatever reason? Are they going to find a bed?
Oh, well, absolutely. The short answer is yes. We are open and seeing patients. Every emergency department in Southern California is doing the same thing. I think the gist of that information was that, if you have very mild symptoms or, mild runny nose or a mild cough or a sore throat, try not to utilize the emergency room as they are inundated and the hospitals are very busy. And those are very true statements. So if you can try to, stay out with those mild symptoms, that would be great. Things to look out for are the usual stuff as far as chest pain, shortness of breath. If you're experiencing those kind of things, do not wait and please go to the emergency room so you can be seen and evaluated.
Mm-hmm. Well, Dr. Jamehdor, Omicron, it is so prevalent, and many of us have been through this. And one of the most common Google searches asks, what do you do if you've been near someone who has been exposed to COVID? Not necessarily has COVID, but has been exposed. So what's your advice?
Well, so I think, basically, if you take yourself one step back and look at if you were exposed to someone who has COVID, you basically have to assume that if someone had COVID, that could be contracted very easily, especially with this Omicron. So with those recommendations from the CDC are basically falling into different categories. So if you are vaccinated, no need to get quarantine. You have to be careful for about 10 days, meaning, not going to places that where you sit down and take your mask off, such as a restaurant. They don't recommend traveling, and they recommend getting tested within about 5 days after that exposure. If you are not vaccinated, then they are recommending that you do quarantine for 5 days and get tested. After that, follow the same steps of being very safe for the next 10 days, as far as not being exposed to areas where you're taking your mask off. And going from there. And also the third category is basically if you've had COVID within the last 90 days, you basically got treated as if you've had the vaccine. So no need to quarantine. You do have to be safe for about 10 days. Also get tested within 5 days and, be extra careful when you're out and about. The specific question of being exposed to someone who was exposed, that gets a little bit more difficult, and it depends on, I would really just take a case-by-case basis. And if you're, 85 years old and have diabetes and hypertension, I would treat it as if I was directly exposed and do what we just talked about. If you're a 25-year-old healthy person who's been vaccinated, I would probably, feel a little bit safer.
I want to follow that up, though. So far, we keep hearing isolate, wear the mask. But what is the actual treatment now 2 years into this? If you know you have COVID and you're like, I'm breathing okay, what are the treatment options for people at this point? What should they be doing at home while they're isolating so they're not getting worse and then needing to go to the hospital and potentially maybe needing a ventilator or something?
So luckily, it sounds like about 80% or so of all COVID infections right now are Omicron infections. And it is very, very similar to what we've dealt with before and kind of know how to deal with at home, the common cold and the regular flu. So all those things that we used to do for those kind of things, vitamin C, drinking hot tea, taking care of the fever with Tylenol or Motrin, and getting a lot of rest and drinking plenty of fluids. I know it sounds layman terms, but that's pretty much what we're treating Omicron with.
Okay.
And 2 years later, like you said, not a lot of new medicine to really treat those kind of infections. They have a new monoclonal antibody that's come out that seems to be a little bit more specific towards Omicron itself, as opposed to the Regeneron, which was better for the Delta. However, good luck finding it, and it's very limited use.
Okay. Well, thank you so much for your time, Dr. Ali Jamehdor. Appreciate you for joining us today, and you have a great weekend. Thank you again.
Thank you. Thanks for having me.